Thank you, Mr. President. In the 10 days since I last addressed this honourable court, the solid situation in which our island finds itself has continued. Yesterday was the 26th day with no new cases. I don't take any of this for granted. It came about as a result of hard work, sacrifices and, of course, the tragic loss of life of 24 of our people. We must never forget that. And each day when I hear that there are no new cases, it is never with joy. There is no sense of frivolity. It is with relief that we have been through another day without a loss of life or horrid suffering. Mr. President, what our current situation has allowed us to do is to be optimistic. It has allowed us to be bold. For so long during this pandemic, we were walking a tightrope. We inched forward. But now we are able to put our best foot forward with more confidence. For some time I have said that we wanted to step out of our people's lives. I regretted having to intervene in people's homes. I regretted having to come between our people and their loved ones. But it was necessary for the good of our island community and especially our most vulnerable. Social distancing, along with robust hygiene practices, was such an important weapon in dealing with this terrible virus. I know that this came at a price. It pushed our community apart. But our new situation has allowed us to step out of people's lives and make their own decisions. Yesterday, we were able to remove the need for social distancing. The exception for this is medical and care settings, where the need for PPE and social distancing will remain in place for a little while longer. Yesterday, we were also able to remove the final restrictions on people coming together. This was such an important development for our social fabric. People can now gather as community groups, as friends over dinner, or in pursuit of a ball around the pitch. Mr. President, I have been humbled by the reaction of the Manx public. People may not have agreed with every decision that government took, but I have been touched by the reaction of people who have told me that they are now able to see the light at the end of the tunnel as our community comes back together. Mr. President, today we can go for a meal, we can go to the gym, we can play football with our friends, we can invite people around for dinner, we can shop, we can use local services, our shops are open, our economy is gearing back up, our teachers are preparing the schools for the return of our children, and people can hug their family. Things are starting to feel normal again. And on the 18th of June, we will remove some of the last measures. We are stepping back and allowing those elements of our lives that posed real concerns for us when the virus was moving quickly around our island to open when they are ready. We will soon be able to have a pint in the local. We will be able to go to the cinema or the theatre and go for a swim. By the end of this week, we have taken a major stride out of the lives of our people. One thing that will remain in place until next week is the temporary all-island speed limit. I made a commitment that we would not seek to introduce a more permanent limit by the back door, and I stand by that. The Council of Ministers considered the question of a speed limit carefully and decided that an incremental return to the pre-COVID situation was the right thing to do. Thereafter, it will be for this honourable court to make decisions for the longer term. Mr. President, there are 3 areas on which I would like to update this honourable court. 3 subjects that have been of special interest to honourable members. These are the borders, readiness for a resurgence in the virus, and plans to exit the state of emergency. Mr. President, the closure of the border has been an integral part of our defences so far through this pandemic. It has allowed us to concentrate on the virus present on the island through testing and contact tracing, while minimising the risk of importation of virus from elsewhere. The Council of Ministers is clear on 2 things. Firstly, that we cannot keep our borders closed forever, but secondly, that now is not the moment to make significant changes. The Council of Ministers has been considering a framework approach that, in due course, may allow more latitude for our residents to leave the island and return. But this will be dependent on the situation in countries around us, especially but not only the United Kingdom. And while there does seem to be a gradual improvement there, it is still not where it will need to be for us to make real changes to our approach. We know that our border controls are themselves keeping families apart. We are doing everything we can to accommodate requests on genuine, compassionate grounds. Mr. President, on the question of readiness should the virus rear its head again on our island, I hope to be able to reassure honourable members. We only have a small number of people coming to our island, returning residents and those critical to keeping the island running. Those people are still required to isolate. It is not impossible that we will see a new case at some stage. This will not be a sign of failure. Our contact tracing team will be ready to investigate and break that chain again. We will maintain a COVID 111 line and our testing capability until they are no longer needed. Everyone on our island has a role to play in maintaining a level of readiness. In our new guidance, we have reminded people of the need to take symptoms seriously and call 111 if in any doubt. We have reminded businesses that they may need to act quickly if new cases do emerge. As part of this, we are producing a guide to show people what we might do if the need arises. When we have concluded discussions with our clinicians and industry, we will publish the guide so that we have a shared understanding of the path should we be forced to step backwards. Reinstating measures from which we are now exiting would be a last resort. But I want to be as transparent as possible with the public. We would not be where we are if it hadn't been for their commitment and resolve, and we owe them utmost honesty. Mr. President, finally, and again in the spirit of transparency, I would like to brief honourable members on our plans to exit the state of emergency. I've told this honourable court before that I did not enjoy asking His Excellency to declare the state of emergency. I have not enjoyed having the powers that came with it. I do believe that it was a necessary evil. We wanted to find a consensual approach for the best of our nation. I had hoped to be able to brief honourable members yesterday and present draft regulations, but time was, Mr. President, as so often, our enemy. We concentrated on dealing with the steps necessary to lift the regulations in place to enable the public to freely gather in their homes and in public without restraint. We also were working to enable all premises to open, including pubs, nightclubs and theatres, from Thursday this week, enabling us to revoke the regulations restricting the opening of all businesses and other premises. We were also working to lift the restrictions on speed limits imposed by regulation from next week. We have invited His Excellency to renew the proclamation, which he did yesterday. We did so very much with the intention of asking him to lift it early next week, assuming that the island continues with its splendid response to the fight against the pandemic. Before then, it is our aim to finalise which of the current suite of emergency regulations would cease when the proclamation is revoked, and which we still need and will lift more gradually by means of the continuing regulations. The Council of Ministers will on Thursday consider the detail of what is proposed. The aim is to then circulate to all members of this court in advance of making continuing regulations to seek your views. We will continue to listen. We would aim to introduce these continuing regulations by the end of this week or early next, as they must be in place before the proclamation of emergency is lifted. All things being equal, we would hope to invite His Excellency to do this by the 22nd or the 23rd of June. Mr. President, the struggle against COVID-19 has not been easy. We will, of course, always mourn those who we lost, but we still have plenty to be grateful for on our island. We have now stepped out of people's lives. Our community can come back together, our economy can thrive, and our island can look towards brighter times. Mr. President, I and other ministers will keep this honourable court informed as often as possible. Thank you.
Thank you, Chief Minister. It's an opportunity for questions, Mr. Speaker.
Thank you, Mr. President. The Chief Minister mentioned, as part of his statement, about reopening schools to all children next Monday. Can I ask the Chief Minister, will that then be a right of all parents to send their children back to school on Monday? And will he be able to guarantee that no child will be turned away from school next Monday? As I think some parents, certainly speaking to some last night, were getting mixed messages. Secondly, with regards to the border, is the next step to stop public servants deciding on what are and are not compassionate grounds, but to allow free access, but then to still require home quarantine and more resources on ensuring enforcement with home quarantine? Is that what the next step of the border is going to be, whenever that might be?
Chief Minister to reply.
Thank you, Mr. President. I thank my honourable friend and colleague, Mr. Speaker, for his 2 points of his question. The answer to the first point is yes, it is our intention to open up for all children, and no one will be turned away. However, what we are saying is that parents, if they feel uncomfortable, will not be forced to send their children. They could start to send their children back to school at the start of the new school year, should they wish. But it is our intention that all will be able to come and no child will be turned away. Regarding borders, obviously Mr. Speaker has obviously just give a little clue in an answer to one of my questions yesterday regarding the borders, where it is our intention to look at ways where we can help people from the Isle of Man move off the island in a far easier situation where, yes, we do get out of people's lives. I have to commend my team in the repatriation team. It's not been easy. It's been probably one of the toughest jobs in government. It's something I personally regretted that we had to do, but I'm absolutely confident it was the right thing to do. But they've had a really tough time, and anything I can do to help them as much as anyone else will be, and that's something we are currently working on, and I hope to be able to update this Honourable Court when we have come to the conclusion, with obviously the advice of our medics, our public health, Mr. President, etc. So I hope I've answered the question.
Honourable Member for Middle, Mr. Shimmons.
Thank you, Mr. President, and I welcome the Chief Minister's statement. Given the continued surplus capacity in our testing capabilities, why are we not testing all new arrivals at this time for COVID-19?
Chief Minister to reply.
Thank you, Mr. President. And the Honourable Member does bring up an interesting point. We do have capacity at the moment. We can do up to 200 tests a day, and clearly we're not hitting that. But obviously we, as a government, offered several thousand people the opportunity to be tested. All our teachers, everyone working in a school, all our NHS employees, all the blue light, as other services are known, our police, fire brigade, ambulance service, etc. We have had an amazingly very low response to have that test. Now, if you offer thousands of people the opportunity to have a test, Mr. President, and you know you can only provide 200 a day, then we needed to keep capacity for that potential uptake. Now, we do test everyone who the medics feel on the COVID 111 helpline that they feel needs to be tested. We do test everyone that goes into Noble's Hospital if they're admitted for the test, and we have kept that capacity open. Now, obviously, we can only keep that capacity open for so long before we look at other measures. Moving on to testing on new arrivals, the current medical public health advice, Mr. President, is that Mr. Shimmons, for example, and myself could go away on a parliamentary meeting to Westminster, where we unfortunately come across someone who was suffering from COVID-19. We come back the following day and we're tested. We would probably come up as negative. We're then tested 3 days later, Mr. President. We would come back as negative. We could then, if a trial is going on, which I think I alluded to in our previous discussion around this area, which Jersey are trying out, we could then go around freely spreading the illness, not aware that we have it, because the tests have not shown that they do not. If you have it, there is no guarantee that it will say you have it. It's only when you are exhibiting the symptoms, Mr. President, and the public health and medic concern is that it would give a false sense of security to people coming back if they have the test and are told that they are negative, and then therefore free to move around the island. Now, obviously, advice and evidence and the experience of other jurisdictions is constantly changing, and we have asked our medics and public health to review this advice to see if there is a better way forward, and maybe a test may be the answer coming in. There is one, for example, Mr. President, in Dubai, where they do a finger prick test for everyone flying into Dubai airport. However, that has not been assessed by a reputable organisation, and therefore the data, etc., at this moment in time is not available. Thank you, Mr. President.
I'll let Mr. Shimmons have a supplementary briefly if he wishes.
Yeah, thank you, Mr. President. And the Chief Minister raised 2 points in his response, which were interesting. First of all, the unused capacity. Disappointing that the thousands of people who have been offered haven't taken up the offer of a test. I'm sure that they would understand, given they've had ample opportunity, if the capacity was diverted to new arrivals because of the higher risk that new arrivals bring to the island than people who are already on the island, which is COVID-free. So I'd just like the Chief Minister perhaps to reconsider if the capacity is his major concern. Surely we can manage that expectation amongst our public servants. Secondly, in terms of, yes, the test has some limitations, but that's the same with all the tests that we've been relying on for months. Can we not please look at the best practices that we are seeing adopted by other jurisdictions across the globe, looking at double testing, different types of testing, if we accept that there is a risk from new arrivals with our borders, why are we not testing in a more intelligent and dynamic way? Thank you.
Chief Minister.
Thank you, Mr. President. 2 points there. I think new arrivals, will we review? Yes, Mr. President. I do share the Honourable Member for Middle's concern on that one. I think even if we picked up, say, 10, 15, 20%, but I am not a medic, Mr. President. I am not a health advisor. I need to get the opinion of those areas to reconsider and review and see what could be picked up. And I know the Minister for Health and Social Care will be looking at that with his team. So there is a commitment there from me to review on that one, because I do fully support that. Best practices, and I suppose really that's where I'll maybe show examples of, if we've been compared to New Zealand, Mr. President, it quarantines for 14 days. We've been compared to Guernsey, it quarantines for 14 days, all visitors coming in. New Zealand, for example, you've got to go into an isolation unit. You can't go home and self-isolate. You must go into an isolation unit. So there are various best practices out there, but as the first in the British Isles to be COVID-19 hopefully free at this moment in time, we've not done too badly. So we could say that some of our best practice is good enough that other countries could look at. But obviously you never stop learning, and if anything comes along where we can see good data to support us changing our systems at this moment in time, we will of course look at that, Mr. President.
Now, I've got a growing list of members. Let's see how efficiently we can get through this. Mr. Hooper.
Thank you very much, Mr. President. This is sort of building on the question from the Honourable Member for Middle. Actually, the Chief Minister mentioned New Zealand in his comments just then. I'm sure the Chief Minister is aware of recent news reports of new cases being imported into New Zealand, and that really highlights the importance and the value of our own border restrictions in that context. But in the context then of looking at further gradual development of our border strategy and appreciating the limitations of testing, I wonder if the Council of Ministers are considering means by which the need for a full 14-day quarantine might be able to be mitigated in part for Manx residents who need to travel through the use of testing of arrivals, or possibly multiple testing spread over a period of time, as was previously done for some key workers under the old regime. Thank you very much.
Chief Minister.
Thank you, Mr. President. I thank my honourable colleague for Ramsey, Mr. Hooper, for his question. He does raise a valid point. I think hopefully for the good people of New Zealand, the 2 cases which I'm told are from the United Kingdom, with people coming in from compassionate care, were stopped from spreading because those 2 people had been in quarantine. As New Zealand has the same period as ourselves, they were allowed to go to visitor hospital before the 14 days was over, but they took a separate taxi. So it'll be interesting to see what happens, and I sincerely hope for the good people of New Zealand that this didn't get spread, though obviously they shared a plane, etc. So it's too early to comment on that situation. I know I have a weekly phone call, Mr. President, with our colleagues in Jersey, Guernsey and the Justice Department, and I know the Chief Minister of Guernsey is potentially looking to trial a 8-day quarantine where they feel that 80% of all the cases can be caught, and therefore maybe their own system of contact tracing, etc., might be able to catch the remaining cases. That said, they weren't confident themselves that they may do this. So others are looking at various systems, but the most secure system at this moment in time, and I put that marker down, is 14 days. That's the time of the potential spread, because you don't know when you've caught it. It's only when you're exhibiting symptoms that the test picks up that you've got it. Now, there could be a vaccine, there could be another test which picks it up from the day you contract it, and if that comes along, then that could well be a game changer on how we alter our borders. But until then, I really do think that our 14 days is our big gun in our defence against a second wave of spread on the Isle of Man, which I'm sure we all don't want, Mr. President.
Member Mr. Thomas.
Thank you, Mr. President, and I also welcome the Chief Minister's encouraging statement today. In the interest of encouraging this progress of Tynwald, could the Chief Minister confirm then that in his expectation of 22nd, 23rd for lifting the emergency and for developing regulations under the Emergency Powers Act, including in continuing regulations by then, that it might not actually be necessary for Tynwald to move to that effect at item 16? So could the Chief Minister confirm? That's what I heard clearly him say a moment ago. And also, in respect of item 11 about public documents, that would be something that would be caught up in the process of making new regulations. So can the Chief Minister give a clear statement about the government's intention in respect of the slight issue that I know I want to resolve, and I believe the Chief Minister and the Chief Secretary does, in terms of the slightly unanswered question as yet about public documents and statutory documents and their publication, because perhaps Tynwald might be of the view it would be helpful not to move items 11 and 16 if we can have a clear, categoric assurance today from the Chief Minister at this moment in respect of his intentions.
Chief Minister.
Thank you, Mr. President. I thank the honourable member for his comments. Yes, I think item 16 is null and void. The motion proposal is that the Council of Ministers before Friday the 26th of June, whereas we've clearly committed the last date, I think it's the 22nd, Mr. President, and that's for the speed limit. Obviously there will be continuation powers, which I have said I will be sharing with all Tynwald members the minute we, once we've had our meeting of Council of Ministers on Thursday to decide what needs to be extended, and then we will go out to all honourable members to seek their views before we have our meeting. So item 16 is, I don't see any point in moving it. That's entirely up to the honourable member, but I do give a commitment that it is a genuine Council of Ministers decision. I've said time and time again, Mr. President, I never wanted these emergency regulations, but they were a necessary evil, and the sooner we can get out, we all want to get out, and we feel the 22nd, the 23rd is the time when we can do this. So I think item 16 on our agenda can go. Item 11 was public documents, and I was always concerned about what the member was trying to achieve here and the law of unintended consequences, because the way the honourable member has written it, if memory serves me correct without giving too much away in my speech on this, very short one though it was, is that effectively as a result of the honourable member's intention, the law of intended consequences was that everyone who has been told to self-isolate at home, their name would have to be declared. And that, I don't think, is what this Honourable Court would want to know who has had coronavirus. Obviously, here I am, I'm one, but I don't think the 335 other people would feel it right that Tynwald members should have access to that information. So that's for the honourable member to... I don't think his motion... Obviously, I wasn't going to support his motion for 11 because I think...
If it could help, I don't want us preempting debate on items that may or may not be moved in the order.
Right.
Confine it to...
Okay. Thank you, Mr. President.
Statement and the questions accordingly.
Yeah, I was trying to reassure so we could avoid having two items later on, Mr. President. So I was trying to get a little bit of brevity on this one. Thank you very much.
Thank you very much. Mr. Ashford.
Thank you, Mr. President. I will be brief. Would the Chief Minister agree with me that we haven't just simply been relying on tests, but actually we've been relying on the 14-day self-isolation? Because would the Chief Minister agree that even if someone comes back with a negative test, who's been for testing in the community, they still have to self-isolate for the 14 days. Is the Chief Minister also aware that obviously the most accurate type of test for COVID-19 is PCR testing because it looks for the viral RNA? But is he aware also of the report recently done by the University of Bristol, which states that false negatives in relation to COVID-19 might be as high as 20%? And is he also aware of the current research that shows that the most contagious period for COVID-19, they're now saying, is in the couple of days prior to symptoms showing? So you are actually more contagious than when the symptoms actually show. So does he agree with me that actually the 14-day self-isolation combined with the test is what has actually got the island into the position it's in now? Thank you, Mr. President.
Thank you. For the sake of brevity, Mr. President, I totally agree with what the honourable member for Douglas North has said. Thank you.
Honourable Member Mrs. Corlett.
Thank you, Mr. President. Would the Chief Minister agree that as we get back to our lives, now we can get back together with family and friends, loved ones, people going back to school and our vulnerable residents are encouraged to get out and about again, the border and how we control it is now, more than ever, of vital importance? But would he also agree that it is a double-edged sword in that borders are our greatest defence but also our greatest risk? COVID-19 was imported into the island. It didn't originate here. And as we come away, rightly, from regulating people's daily lives, the sea that surrounds us provides us with the best protection we have against a resurgence of the virus. Would he agree that any lifting of restrictions on travel to the island must be carefully considered, carefully planned, but most importantly, it must be in the best interests of all our island residents? Thank you.
Well, I'm sure the Chief Minister will agree. Never know. Your own words, by all means.
Thank you. Yes, I do agree with the honourable member, Mr. President. You'll be glad to know 99% of all the emails I get thanking the government and Tynwald members for everything that has been done ends with, please keep the borders where they are. Thank you.